Hi everyone, my name is Katrina Wong and I'm a physical therapist at PhysioFit Physical Therapy. And just thank you so much for coming to our April Q&A. We'll be talking about pelvic health, digestion, and bowel movement. So we'll get started. I'm just going to share my screen. So like I said before, we here at PhysioFit Physical Therapy, we do monthly Q&As and we do it on various topics. So for April, I decided to do bowel health, digestion, and the pelvic floor because I know it's something that's very common in our community and just general population, but it's not really talked about. So again, with the presentation, if you guys have any questions, please feel free to type it in the chat. If appropriate, I might answer your questions during the presentation, but I will definitely get to them at the end. All right, so a little bit about me is I graduated with my doctorate of physical therapy from Mount St. Mary's University in Los Angeles. And I'm very passionate about pelvic health, women's and men's health. And I specialize in the evaluation and treatment of different pelvic floor dysfunctions, including urinary incontinence, constipation, fecal leakage, tailbone, back, pelvic pain, as well as pregnancy and postpartum rehab. So that may include like pubic bone dysfunction, diastasis rectus abdominis, and so forth. I also treat men. So for example, if you had a prostatectomy, I also do post-prostatectomy rehab. So that's just a little bit about me. Just as a health disclaimer, this workshop is for educational purposes only, and it is not physical therapy treatment, and it is not healthcare advice specific to anything that you may be experiencing. So as always, if you have any specific questions or concerns, it's always best to have a one-on-one individualized appointment or just to seek a healthcare provider. All right, so what we're going to do today is we're going to talk about the importance of poop. We're going to talk about anatomy, so the digestive system, as well as the pelvic floor. We'll also talk about what healthy bowel movements look like, and then what unhealthy bowel movements look like, and then dive into constipation. I'll also go over some tips for optimizing your bowel movements in your poop, and then how pelvic floor physical therapy can actually help.
Okay.
All right, so why should I care about my poop? So I just wanted to start off with this because your poop really tells you a lot about your digestive health. Your pooping is one of the best ways that your body actually maintains the hormone balance. So in particular, for example, your bowel movements is how you eliminate excess estrogen in your body. And specifically for females, having too much estrogen in the body can be very toxic, and that can lead to headaches, PMS, frequent or heavy periods, as well as hot flashes. So just by having a regular bowel movement, you're eliminating any excess hormones or just toxins in your body that it doesn't need. Your poop can also tell you a lot about your gut microbiome health. So your gut microbiome is the bacteria that's in your gut. So in your gut, that we're talking about your large intestine. So your large intestine contains a lot of different bacteria that's really great for fighting off any pathogens or just bad stuff in your body. It also helps boost your immune system. And it also makes very important vitamins such as biotin, vitamin K, as well as folate, which you can get through your food, but also your gut produces these as well. Your poop can also tell you about any food sensitivities you have. So if you are gluten-free or sensitive to gluten or lactose, you may notice some changes in your poop. And then your poop can also tell you a lot about your hydration levels. So if you are dehydrated, you may have more hard, lumpy stools, for example. And then lastly, if your poop is all over the place, you may just be really stressed. So there's something called the gut-brain axis. So if your brain or if your mind is very stressed, your gut can actually respond to the stress that you're experiencing. So your gut may be, again, stressed, so then you may be more constipated, more diarrhea-like, and so forth. So there are many reasons why you should care about your poop, and I just wanted to outline some of these reasons so you know why it's important. So I just wanted to bring up some common complaints I hear from people who come see me. Are you super gassy? Some patients say that they're super bloated after they eat or they feel nauseous. Do you have abdominal pain? Some patients will say that they see poo stains in their underwear, whether that's when they're playing tennis or exercising. Others will say on the opposite end that their stools are really hard and lumpy. So it's really hard to defecate. They might have to push to get their poop out. They may even notice that their urges to have a bowel movement are very slight and subtle. So they may have that slight urge, and then when they go to the bathroom, the urge is gone, and then there's nothing really coming out. I also have patients telling me they have fecal leakage or even bleeding with bowel movements. So these are just some very common and common complaints or concerns that patients will bring up. I just wanted to bring these up just in case you may be experiencing any of these, know that there is help out there. So we'll first talk about the anatomy. So the digestive tract begins in your mouth and it ends at your anus. And it's a very long, and the average amount of time that it takes food to go from your mouth to your anus is about 30 to 40 hours. And in women, it can actually reach up to 100 hours. One of the reasons may be specifically for pregnant individuals, because there is an increase in progesterone, the gut is a lot more sluggish. So it takes a longer time for food to just transit or make its way throughout your intestine. So again, the food goes into the mouth, down the esophagus, into the stomach, small intestine, large intestine, the rectum, and then the anus. And then if we really look at the pelvic area, stool is going to build up in your rectum here, as you can see. This is a side view of your pelvis. So again, stool is going to build up in the rectum. The rectum is right in front of the tailbone, and in the front we have our pelvis or our pubic bone region. So again, when you're eating, the stool is slowly going to collect in your rectum. And when the pressure of the rectum exceeds the anal pressure, then we'll have a bowel movement. So you can see that along or around this rectum, we have the pelvic floor muscles. So these are muscles like any other muscle of our body, but they form a sling around your anus as well as your rectum. And they make sure that you stay continent when you want to not poop. And they also make sure that they allow a bowel movement to happen. So these pelvic floor muscles play a really important role in making sure you want to poop at the right time. So here's a closer look. So you can see this is kind of like a cross section or a cut slice through the rectum. So here is the stool, and then you can see that there are muscles that surround the anus and the rectum. So when these muscles are when the muscles are contracted, it's going to squeeze or close that opening so the poop will stay inside. If those muscles relax, so if the opening opens, then the poop will exit out. So these pelvic floor muscles are kind of like, it's like a tight rubber band. So when the tight rubber band is really tight and it's knotted up, your poop's going to stay inside of you. If the rubber band is nice and loose and relaxed, then that will allow the stool to come out. So again, your digestive system starts from your mouth, you're eating, and then it'll go all the way down into your anus, and then it's eliminated when your pelvic floor muscles relax to allow the stool to come out. So here's a quick video just showing the function of the pelvic floor. So we can see that we have our pubic bone here and our tailbone in the back, and the pelvic floor muscles are in red. So I'll play the video again, but we have our bladder here in yellow. So this is a female model. We have our uterus and our vagina, and then we have our rectum. What happens is when the pelvic floor muscles contract, it allows the urethra and the rectum to stay closed. So that allows stool to stay inside of us. When the pelvic floor muscles relax, that allows the stool to eliminate. So I'll play it one more time. I think this is just a great visual showing how the pelvic floor muscles can play a role in maintaining your continence, but also play a role in helping you eliminate your stool. So this, women and female, all people have pelvic floor muscles. So in men, it would be the exact same thing. Again, those pelvic floor muscles surround the anus, and when they squeeze, your poop stays inside. When they relax, your poop gets eliminated. So we're going to talk about what healthy bowel movements look like next. So what is considered normal? So the normal for a healthy bowel movement could actually range from a frequency of 3 times a week to 3 times a day. So a lot of people think I need to have a bowel movement every day, but sometimes it's normal if your normal is to have it just 3 times a week. So for example, let's say my normal is having a daily bowel movement, but then all of a sudden I'm having 3 a day. That wouldn't be considered normal for me. Another example is, let's say you're used to having like 2 a day and now you only have them like 3 times a week. That would not be considered normal for you because it's not your normal. So it's important to know what your normal is by just being aware of what you find to be what's regular in terms of eliminating your stools. We also want to have a type 3 or 4 on the Bristol stool chart. So the Bristol stool chart shows 7 different types of poops. So type 1 being very hard and lumpy, and then type 7 being very watery. So you really want to aim for type 3 and 4. It's more like a sausage, snake-like shape, and it's not blobs. It's not too fluffy or cloudy. It's very solid and it has some type of form to it. We should also be aiming for a brown type of color, as well as being able to eliminate your stool without pushing or straining. So once you get the urge to have a bowel movement, you should be able to walk comfortably to the bathroom and have your stool be eliminated within 30 seconds to a minute, I would say. If you're having to push to get it out, that would not be considered normal. Your reflexes in your anus should know that once you sit on a toilet, it should just happen naturally. There shouldn't be any extra or too much effort to get the task done. So constipation, this can actually happen up to 80% of Americans in some point of their lifespan. So that's really common. Now, constipation is a symptom and it's not a disease. So constipation means that you have 2 or more of the following symptoms below in the past 3 months. So I want to point out that you can still be constipated but not have hard and lumpy stools. Some of my patients tell me that they're constipated, but their stools are just kind of liquidy and more watery. So they're still going to be constipated because they may have to like push or strain, for example. So constipation may consist of having to strain, having hard or lumpy stools, feeling like there's incomplete emptying of the rectum. So feeling like you go poop, but then you feel like you're not fully completely able to empty and you have to go maybe 30 minutes later. Also consists of the sensation of an anorectal obstruction or blockage. So feeling like something is blocking internally your ability to eliminate your stool. Another characteristic is having to use manual maneuvers to eliminate stool. So some patients, in my females, for example, have to insert their finger into the vagina to actually push on their rectum to help eliminate. Having less than 3 bowel movements a week can also be another characteristic. And then also having loose stools that are rarely present, even with taking laxatives, is another characteristic. So if you're taking laxatives to kind of help soften that stool and still nothing is really happening, like stools aren't really getting any softer, then that is also a characteristic of constipation. So to have constipation, you only have to have 2 or more of the following in the past 3 months to be considered to have that diagnosis. So symptoms of constipation include a variety of factors. Some patients report bleeding with bowel movements, having hemorrhoids, anal fissures, bloating, depression, bad breath, or even decreased appetite. So we'll dive into a little bit more about hemorrhoids. So again, these are just symptoms of constipation. Doesn't mean necessarily you have to have all of them, but they are just some common symptoms. So hemorrhoids are a very common, I find, factor in patients who have constipation. Hemorrhoids are anal cushions in your rectum or your anus, and they happen when you tend to push or strain when you're having a bowel movement. So if you're pushing and straining a lot, you're going to put a lot of pressure on those cushions, and they can actually bleed. So you may notice when you wipe, you have some blood, and it can also be very painful. So it's important to note that if you're trying to have a bowel movement, try not to push or strain, otherwise you might irritate these anal cushions. Anal fissures are also very common. So anal fissures, you can think of like a paper cut. So anal fissures happen in the inner lining of the anus, and it's basically a very small or thin tear. And it occurs if you're having to pass a really hard stool. So again, if you're pushing and you're straining and that stool is very hard, you're going to put more of that pressure in the anus, and that may microscopically tear the inner lining of the mucosa. Some associated conditions with constipation include small intestinal bacterial overgrowth, irritable bowel syndrome, lactose intolerance, as well as gastric acid reflux, as well as celiac disease. So if you have any of these conditions, you may also have constipation. Doesn't always mean that you do. So why am I constipated? So we're just going to dive into two different categories of why you may have difficulty eliminating your stools. The first one could be that your colon is very sluggish. So your colon contains muscles around that tube that help contract and relax to allow the stool to move through. If the colon is very slow, if it's not moving the stool very well, that's known to have a very sluggish colon. And patients or individuals may report that they feel their abdomen is distended, or that they feel bloated because the stool's kind of just staying stuck in there. They may note very infrequent urges to defecate, and they may also have some abdominal discomfort. The other reason you may be constipated, again, these are only two of many, is that you may have something called dyssynergetic defecation. So like I said before, your pelvic floor muscles are like, they're like tight rubber bands around your anus. If those muscles are staying nice and tight, then it's going to be really hard to eliminate your stool. So dyssynergetic defecation means that when you're trying to have a bowel movement, your pelvic floor muscles actually contract rather than relax. So it's doing the opposite. So just to rephrase, when you want to have a bowel movement, those muscles, your pelvic floor, should stay nice and relaxed. If they're tightening, so they're doing the opposite, then it's going to be really hard to have a bowel movement. So dyssynergetic, meaning kind of like the muscles aren't working in synergy. They aren't working at the correct timing, for example. So your doctor may diagnose you as having pelvic floor dyssynergia, may have a paradoxical pelvic floor, or having obstructive defecation. So that's what your doctor may say that you have if they notice that your pelvic floor is not working the way it should when you're having a bowel movement. So contributing factors to constipation, there are so many. We'll dive into some of these. So for example, if you're not drinking enough water, we kind of talked about that a little earlier with the hydration factor. If you're stressed, traveling is a big component, especially if you're traveling where there's a big time difference. If you have poor eating habits, lack of exercise, or like I said before, just having very tight pelvic floor muscles, so the pelvic floor muscles aren't working the way that they should. So the first contributing factor to constipation is insufficient water intake. So dehydration can lead to hard, lumpy stools. So you really want to try to aim for drinking half your body weight in ounces. So if you're not drinking enough water, again, your stools are going to have a really hard time getting through your system because it's so hard. So I usually recommend drinking half your body weight in ounces. So if you are 100 pounds, you should drink around 50 ounces of water. If you're 150 pounds, you should drink around 75 ounces of water. So the typical saying 8 glasses of water may not apply to everyone because everyone is a different body weight and everyone has different needs. I also recommend trying to sip water throughout the day rather than gulping all at once. And I also typically recommend that whenever you have a glass of tea or a coffee, that you also try and drink a cup of water with it, because coffee and tea can actually dehydrate you. So sometimes people may say, just eliminate any of those bladder irritants that dehydrate you. But I like to try and still have you, consume your coffee and tea if you really love it, but still just drink some water along with that as well. Another factor to constipation could be your fiber intake. So you should really try to aim to consume about 35 grams of fiber a day or more. And there's different types of fiber. So we have soluble and insoluble fiber. So the soluble fiber helps bulk up your stool. And examples include apples, bananas, barley, and then insoluble fiber helps speed up the transit of your food. So if you have a sluggish colon or a very slow working colon, you may want to consume more insoluble fiber because that will again help speed up the transit time of the food. So examples of insoluble fiber would be whole grains, most vegetables, wheat bran, as well as legumes. Some of my patients will also say that when they're constipated, that Miralax really helps. So Miralax is a over-the-counter medication that you can take. And what it does is that it helps draw water into the stool to soften it. So I like to offer individuals with Miralax alternatives. So alternatives that you can get through your food. So this may include like avocado, spinach, dark chocolate, kiwis, almonds, even lemon water in the mornings I find to be really helpful. So here's just a slide to show that you don't always have to rely on medications to get your bowels moving. I'm a strong believer that you can get everything through your food if you do it correctly. All right, another contributing factor to why you may be constipated is you're having very poor eating habits. So are you chewing too fast? So a lot of Americans probably only chew about 5 to 10 bites, 5 to 10 times per bite. And we have to remember that our digestion, again, it starts in our mouth. So if we're just like eating really fast and then all the food all of a sudden goes into our esophagus and our stomach, we may feel really bloated because all of a sudden there is a rapid influx of food in our stomach. So I really try to encourage people to chew their food 30 to 40 times per bite. Posture is very important. So are you eating and you're super slouched? So usually you shouldn't really try and eat in a couch or in a very slouchy chair, because if you're kind of slouched over, so hopefully you guys can see me, but if I'm really slouched over, then there's my colon's being very compressed. There's not much room for things to move. But if I sit nice and tall, it gives more space for your digestive tract to move. And it gives more space for the colon, the intestines, and all of that to work better. Meal timing is important. So it's important to eat about every 3 to 4 hours, not only to maintain your blood sugar levels, but also by consuming a big meal. And by big, I mean like trying not to snack. So don't just snack like every hour of the day. You want to eat a pretty good meal, because just by eating that meal, it's going to stimulate peristalsis of the gut. And peristalsis is just what we call movement of the food throughout the gut. So I usually tell my patients to have a really good breakfast, lunch, and dinner. And then if you're going to snack, that's okay. Just don't like snack as that's part of your meal. So you really want to try and get a decent sized meal whenever you're basically in your day-to-day. Lack of physical activity is also another contributing factor. So you should try to aim for about 150 minutes of moderate intensity exercise 3 to 5 times a week. So moderate intensity means that you're exercising hard enough, but you can still talk. So a casual stroll is not really considered moderate intensity, but maybe more of a brisk walk may count because you're working hard enough that you can still talk. It's also really important that you want to combine different types of exercise. So not only do cardiovascular exercise, but also strength training and restorative exercise. So restorative exercise could be like like yoga, maybe Pilates, meditation, breathing. So you really want to combine maybe like that moderate high intensity exercise with some more relaxing exercise, because too much of that cardiovascular activity that can actually increase stress in your body. So you really want to balance. It's kind of like when you're eating, you don't want to eat too much ice cream or too much like fatty foods, but it's okay just in moderation. So you really want to diversify your exercise levels or exercise activities. I kind of talked about this earlier, but having a very tight pelvic floor is something that can impact your ability to evacuate your stools. And this is something, again, that as a pelvic floor physical therapist, I can directly work with. So again, if those pelvic floor muscles are really tight, if that sling is super tight, it's going to kink that rectum. So the rectum is going to be all kind of like bent over, and the stool is not going to be able to eliminate. But if those muscles are nice and relaxed, it's going to open up that sphincter, and that's going to allow the stool to come out. I really like this photo. So what can help is trying to use a squatty potty. So what happens is if you use a squatty potty, it allows your knees to be higher than your hips because your feet are propped up. And when you're using a squatty potty, it allows your colon to be nice and straight. Regular sitting on a toilet can cause your colon to be kind of kinked up. So again, stool isn't going to move as easily because of that kink, because of that like sharp turn. So again, like if you're driving, it's so much easier to drive straight than to do all these random turns. So a squatty potty can be really helpful just to relax those pelvic floor muscles and give your rectum an easier chance to eliminate your stools. So the last few contributing factors to why you may have difficulty eliminating is because you have fascial or scar tissue restrictions. So if you have a history of an episiotomy or perineal tear during labor and delivery, or a C-section, hysterectomy, endometriosis, any type of surgery in your abdomen or even your back, scar tissue or those adhesions can form because of the incision. And that scar tissue can actually adhere to the colon, to your intestines, and they can make it a lot more difficult for the muscles to contract and relax and do its job. So you want to make sure that if you had any history of surgeries, that may actually be a contributing factor to why you may be constipated. I think one of the last ones is ignoring the urge to go. So when you have the urge to go, I recommend going to the bathroom. If you ignore the urge to go, the stool stays in your body for longer time. And the longer your stool stays in, the large intestine continues to absorb water from your stool, making the stool harder and harder and more difficult to go. So if you have the urge, try and go within 5 minutes and don't wait too long. Okay, so we talked about many different factors that can lead to constipation. I just want to talk a little bit about how pelvic floor physical therapy can help. So there are so many lifestyle changes that you can make to improve your bowel movements. Pelvic floor physical therapy is also another option, or I think a combined option that can really help address the root cause of your symptoms. So a lot of patients or individuals that I see, some of them have had constipation for years, like 20 or 30 years. So even if they try and change these lifestyle factors, it doesn't always help 100% because there's something really underlying. there's an underlying problem in maybe their colon, or maybe their valves are stuck, or maybe their pelvic floor is so tight that they can't actually let it relax. So pelvic floor physical therapy can be a really great option to not only address if you have constipation, but if you have fecal leakage, bloating, nausea, or if you're super gassy, it can be really helpful. With physical therapy, like any other muscle that we assess in orthopedics for pelvic floor physical therapy, we usually do a very thorough external and internal pelvic floor and abdominal assessment. And the pelvic floor assessment can be done vaginally or rectally. And of course, it's totally up to the people I see if they're down to do that. But having this assessment provides very good information to what may be causing you to be constipated. So a lot of the questions I ask my patients that come in, so how often do you have a bowel movement? What does your stool look like? What do you do for exercise? Why don't you walk me through what you eat in the day? And I usually ask the weekday as well as the weekend, because usually the workday may be different for some individuals. I also ask patients how long they spend on the toilet. Some of my patients will like go on their phones around their toilet. And the toilet is meant to go poop, or poop or pee, and not meant to just spend a lot of time on your phone, because then your brain starts to associate the toilet with, you don't really have to go to the bathroom. You're just going to spend time on your phone there. So you really want to associate, toilet time with pooping or peeing time. And I'll also ask patients about their sleep. So sleep is really important. So if you're not sleeping well, that's when your body is rejuvenating, renourishing, creating all of that ATP or all that energy to get you through the next day. So I always ask my patients about their sleep hygiene, if they are on their phones before they go to bed, different questions like that. So what may pelvic floor physical therapy look like? So again, like I said before, pelvic floor PT is a wonderful option if you are experiencing any discomfort in your abdomen, slow bowel movements, bloating, diarrhea, or even leakage of stool. So here are just some brief things that I may do with my patients. I may do some diaphragmatic breathing with them. I may do some manual techniques, so in the abdomen or the pelvic floor, to help release any restrictions, tightness, or any tight muscles. I'll also educate them on just lifestyle changes, so toileting habits, eating habits, posture, looking at their alignment. We may also do some pelvic floor and abdominal exercises, or even Pilates-based exercises, scar massage to release any tight scars. I may also instruct my patients on how to do an abdominal massage. So I may teach them on how to stimulate your colon from manually with the hands to help improve the amount of time it takes for the colon, or for the stool to move in the colon. And then I usually ask my patients to fill out a bowel or food diary just to kind of see what their habits are. Sometimes when I just ask people what their bowel schedule kind of looks like, they don't really know. So the diary can be a really helpful tool to just kind of record things and just reflect why my symptoms are like this, or what may be contributing to why I am constipated. So these again are just different treatments or just tools that can be really helpful to get your bowel movements going. So that's the end of the presentation. So yeah, I just really wanted to spread awareness about this topic, because I think a lot of times when I see people who are constipated, they've just been on medications their entire life, or doctors have told them that just drink more water or just exercise more. But there's a lot more to it. There are so many factors that can contribute to why you may be constipated. And it's always great to seek care if you can, to try and get this treated. I have patients who are so constipated that they don't even want to go out and see their friends because they're too afraid they might gas, or they can't find the restroom nearby. So I always think, yeah, your bowel movements, it's such a daily functional activity And just because you're constipated, don't think that that's normal, because now that you guys know what normal is, know that, yeah, that there's help out there. And yeah, you should never be going through this on your own. So you guys can ask questions. I'm just going to put my email there. So if you guys have any questions, you can either ask me in the chat, or you can just email me as well. So someone had asked, what about the opposite problem? So recently I have had occasional episodes of leaking feces, really weird. Anything I can do to prevent this? So that is actually really common. I see it a lot in the people that I see. So the reason you could be leaking stool could be several different factors. So it could be that maybe your pelvic floor muscles aren't strong enough to maintain your stool inside. So if this is your lovely rectum, if the muscles aren't strong enough to close off, if the muscles aren't strong enough to kind of close off that opening, then stool may just be passively leaking out. Another factor that could be contributing to this could be that maybe you're not emptying your stool completely. So some my patients will say they went to the bathroom and then they go on a walk and then they have stool in their underwear. So incomplete emptying of your rectum is another common issue. So if you're not emptying completely, then there's probably a little bit of stool staying in there. So when you're exercising or doing jumping or just any high pressure activities, or even just passive walking or sitting or standing, sometimes the stool can just passively leak out. So there could be other reasons as well, but those are just common, I guess, reasons why you may be leaking. Okay, and then another question is, how can physical therapy help with incomplete but repetitive defecation? So if you're having an incomplete evacuation, something that can help is, again, a squatty potty can help just relax your pelvic floor muscles. Some patients with incomplete emptying also have something called a prolapse. So a prolapse is when there is a bulge, or kind of when the rectum is kind of bulging out, or there's like a pocket of the rectum oozing out. So sometimes when you eliminate stool, not all of the stool will be eliminated because there's a pocket of stool still kind of sitting on the side. So having a squatty potty can help. Also using manual maneuvers like pressing on the vagina to eliminate your stool can help as well. If you're having repetitive defecation, again, I think that's also related. You're not emptying completely. So again, another reason could be maybe the colon motility is slow. So maybe you only have a little bit and then you go, and then you really didn't have all of the stool collected in your rectum ready to go. So there could be a lot of different reasons why you aren't emptying completely, or just having repetitive defecation. Okay, and then another person asked, when I bend, I always get this Charlie horse type of pain where my ovaries are. Can you help with that? So Charlie horses, so like a big spasm, cramp. So the reason that may happen, it could be because your abdominal fascia is really tight, or your muscles are very tight, and whenever you bend forward, it's causing that constriction or that compressed type of feeling. So we can definitely help with that. And it could be something with your ovaries. It could just be something musculoskeletal. So musculoskeletal meaning muscle fascia based. Where and how do you manually assist through the vagina? So great question. So great question. So if I have my pelvic floor model here, so I have my model here, and these are the pelvic floor muscles on the bottom. So again, this is your pelvis. And if I go from the bottom side, we have all the muscles in red. So what we may do is, if your pelvic floor muscles are tight, we may work at the anus, but we may also work at the vagina, and we may do some external work to release these muscles. We may also do some internal work by using a digital finger to release any muscles in here that are tight. So we can work through both the anus, the vagina. We can also work in this location called the perineal body. So we can also work here as well. How do I do that on a daily basis? That's a follow-up question. Great. Okay, so if you wanted to do some manual work on a daily basis, so you can actually use, if you see a pelvic floor physical therapist, your therapist can instruct you on how to manually kind of stretch your muscles on your own. There are also different types of tools that you can use. So there are things called like pelvic wands or dilators. Those are tools that you can actually insert into your vagina or your anus to kind of help stretch out your tissue, because sometimes not everyone can use their own finger to reach down there. You can also help stretch out your tissue by just doing some pelvic floor muscle exercises as well. So there are different stretches that you can do to help relax these muscles. Hopefully that answers your question, Jean. Great. So you guys have any more questions, feel free to type them in the chat or email me. Always welcome to email, and I'm always happy to respond to any questions you have. We do have Q&As each month, so if there's a topic that you want to be discussed, I'd be glad to present that as well. You'll also get a recording if you want to rewatch this, and that should be coming out soon. Oh, okay. So I literally meant how and where do I push to eliminate stool in my rectum? So let me just get my model. So if this is the inside, this is the inside of the pelvis. So this is like a side view. What you can do is you can actually insert your finger into the vagina, and you can press back into the rectum to help push on the rectum to eliminate the stool. So the vagina is right in front of the rectum. So what you can do is, again, just insert your finger into the vagina, and then all you're going to do is you're going to press back towards your tailbone and press on your rectum as you're having a bowel movement. And that can be what we call a manual maneuver to help eliminate your stool. It isn't ideal to do that like if you're not constipated or just to do all the time. But if you're noticing you have difficulty, getting that stool out, then you can try this manual maneuver. So hopefully that visual kind of makes sense. Okay, great. Yeah, thank you everyone for attending the webinar. I hope you learned maybe one fact or one interesting thing that you can do to just improve your digestion and optimize your bowel movements. Again, you'll also receive a recording if you're interested in rewatching it. And again, if you have any questions, feel free to email me.